Community health nursing, or CHN, is a dynamic and evolving field that merges the art and science of nursing with the principles of public health. The community health nurse operates beyond the confines of hospitals, actively engaging in the promotion and protection of health of entire population. Their focus extends from individual care to improving social and environmental determinants of health. In the Philippines, this role is grounded in the standards of public health nursing and aligned with national health policies and priorities. What are the core functions of a community or a public health nurse? First and foremost is assessment. This involves the systemic collection and analysis of community or family health data, identifying health needs and risks, and also resources. The PHN conducts household or family surveys, disease surveillance, and community needs assessment. The PHNs contribute to policy by using assessment data to advocate for evidence-based public health policies. They work with local governments to pass ordinances, such as anti-smoking in public places or any ordinance that improve community health. PHNs also ensure that essential health services like maternal and child care, immunization, nutrition, sanitation, and many more are accessible, equitable, and high quality. They monitor the effectiveness of these services and continuously improve the implementation of these services. PHNs carry out these core functions at individual, family, population groups, and community levels. The Essential Public Health Services, or EPHS framework is a cornerstone of public health practice. It translates the core functions of assessment, policy development, and assurance into 10 actionable services that guide public health agencies and practitioners, including public or community health nurses. Each of these services defines what public health should accomplish in order to protect and improve the health of the populations. Monitor health status to identify and solve community health problems. This involves ongoing collection and analysis of health data to detect emerging trends and risks. Public health nurses contribute by conducting community assessments, identifying priority, and also helping the family and the community identify their health issues and also help monitor progress toward health goals. Diagnose and investigate health problems and hazards in the community. PHNs play a vital role in outbreak investigation, contact tracing, and community surveillance. They assist in identifying sources of infection or risk and collaborate with other sectors to mitigate hazards. Inform, educate, and empower people about health issues. Education is a fundamental role of PHNs or CHNs. They develop culturally appropriate health promotion materials and conduct community based health education sessions. Their goal is to build individual and community capacity for informed decision making regarding health. As partners in community health mobilization, PHNs are skilled facilitators of community engagement. They help form coalitions and partnerships with community leaders, non government organizations or NGOs, faith based groups, and private sectors. These partnerships strengthen community ownership and sustainability of health initiatives. PHNs also have roles in developing policies and plans that support individual and community health efforts. They contribute their expertise to policy development processes at both local and national levels. They help draft public health policies, advocate for supportive legislation, and to promote community driven health plans. PHNs also enforce laws and regulations that protect health and ensure safety. They support the enforcement of sanitation, environmental, and communicable disease laws and programs. They conduct inspection, provide education to ensure compliance, and report violations to appropriate authorities. They also link people to needed personal health services and ensure the provision of health care when otherwise unavailable. PHNs act as a bridge between underserved populations and the health system. They facilitate referrals, assist with navigation of health services, and advocate for equitable access. PHNs ensure the provision of a competent public and personal healthcare workforce. They engage in training and mentoring of health workers such as midwives, barangay health workers, and auxiliary staff. They also contribute to workforce development by participating in curriculum development and providing in service education. PHNs evaluate effectiveness, accessibility, and quality of population based health services. They continuously assess whether health interventions are achieving the desired outcomes. They conduct research for new insights and innovative solutions to health problems. Public health nursing practice must be grounded in evidence. PHNs contribute to research by participating in community based studies, translating research findings into practice, and supporting the dissemination of best practices. Public health nursing in the Philippines is guided by a clear, legal, and programmatic framework. The foundation is Republic Act 9173, also known as the Nursing Act of 2002, which defines the scope and standards of nursing practice across the country. The Department of Health further refines this framework by developing program-specific policies and guidelines that direct how PHNs implement service at the local level. Additionally, the standards of public health nursing in the Philippines provide a comprehensive guide to the functions and competencies expected of every public health nurse, ensuring that their practice remains aligned with both national goals and local health needs. This multi level guidance empowers PHNs to deliver health services that are both standardized and responsive to community specific realities. PHNs work in rural health units, city health centers, and public schools. Public health nurses in the Philippines serve in a wide array of settings, reflecting the diverse needs of the populations they support. Many are assigned to RHUs, which serve as the primary healthcare delivery points in rural municipalities. In urban areas, PHNs are stationed in health centers where they address the complex health concerns of dense and often underserved urban populations. Beyond clinical facilities, PHNs also work within the public education system, serving as school health nurses. Here, they deliver essential services such as immunizations, health screenings, and health education programs to children and adolescents. In addition, some PHNs may be deployed to barangay health stations and specialized government offices to cater to vulnerable groups, such as disaster affected populations or children in conflict with the law. Their roles include management, supervision, direct care, collaboration, education, and research. The role of a PHN in the Philippines is multifaceted and dynamic, requiring a broad range of skills and competencies. The management function is inherent in public health nursing practice. To achieve health goals, PHNs must skillfully apply five key management functions: planning, organizing, staffing, directing, and controlling. Planning involves setting objectives and identifying the actions needed to accomplish these plans. Organizing ensures that resources, both human and material, are structured efficiently to support program delivery. Staffing involves deploying personnel where they are most needed, ensuring that both quantity and quality requirements are met. Directing requires guiding and motivating staff to perform effectively, while controlling ensures that activities stay on track through monitoring and evaluation. These functions are not performed in isolation. Rather, they are seamlessly integrated into the nurse's daily work. In every setting, whether a small rural health unit or a large health center, the public health nurse organizes and manages the nursing service. In smaller units where the nurse may be the only PHN, this includes preparing and implementing the nursing service plan as part of the overall municipal health plan. In larger settings, it involves managing a team of nurses and ensuring that their activities align with agency goals and community health needs. Acting as program managers, they oversee the delivery of services in priority programs such as tuberculosis control, immunization, and maternal and child health. They plan activities, set measurable targets, and allocate resources and ensure that outputs are documented. Regular reporting on program accomplishments is not merely administrative. It serves as a tangible evidence of effective leadership and accountability. Leadership is demonstrated through every phase of program implementation. Public health nurses guide their teams, foster collaboration among stakeholders, and create an environment that supports high quality care. Their leadership ensures that health programs are responsive, sustainable, and aligned with community priorities. As a supervisor, the public health nurse as supervises midwives and auxiliary health workers. Supervision is a critical role of public health nurses. They are responsible for overseeing the work of midwives and auxiliary health workers within their catchment area. This supervision ensures that services are delivered consistently and in accordance with established standards and protocols. Public health nurses regularly check or conduct supervisory visits, guided by well developed supervisory plans. They use structured checklists to systematically review service delivery, adherence to protocols, and the quality of care provided by staff. This process promotes accountability and continuous quality improvement. During supervisory visits, public health nurses work collaboratively with supervisees or subordinates to identify and resolve issues. They provide immediate feedback and guidance when technical problems arise. If additional capacity building is needed, they arrange for further training or mentoring to address gaps. Beyond monitoring performance, supervision is a developmental process. PHNs coach and mentor their subordinates, helping them to build competence, confidence, and job satisfaction. This supportive approach fosters a motivated and high performing health force. Under the PHN's nursing function, the PHN provides direct nursing care to individuals, families, and communities. Providing direct nursing care is at the heart of PHN. Public health nurses serve individuals, families, and communities, offering a full range of care services that support health promotion and disease prevention. Home visits are a key strategy in public health nursing. Through home visits, nurses assess the living environment, provide education and support, monitor treatment adherence, and deliver essential nursing care. When needs extend beyond their scope, nurses facilitate appropriate referrals to higher levels of care or to other service providers. Public health nurses apply the nursing process systematically. They conduct thorough assessments, collaboratively plan care with their clients, implement evidence based interventions, and evaluate outcomes. This process ensures that care is individualized, goal oriented, and responsive to client needs. The overarching focus of public health nursing is on promoting health and preventing disease. Nurses design and deliver interventions that empower individuals and communities to adopt healthier behaviors and to create supportive environments that sustain wellness. As a collaborator and coordinator, the public health nurse establishes partnerships with other health professionals, government agencies, NGOs, and community organizations. Through collaboration and coordination, public health nurses bring together diverse activities and stakeholders to form a cohesive response to health problems. They align services and programs to ensure that they address both the immediate health needs and the broader social determinants of health. PHNs are committed to community empowerment. They work to build the capacity of individuals, families, and communities to take an active role in promoting their own health. By fostering community participation and leadership, nurses help create sustainable health promoting environments. Health education is a fundamental component of public health nursing. PHNs provide tailored education to individuals, families, and groups, enabling them to make informed decisions about their health. They address a wide range of topics from disease prevention to healthy lifestyle promotion. They also take an active role in capacity building. They design and conduct training programs for midwives, auxiliary workers, and even students. By enhancing the skills and knowledge of the health workforce, PHNs contribute to the overall quality and effectiveness of health services. Engagement with research is a key responsibility. Public health nurses participate in research activities such as disease surveillance and program evaluation, and apply research findings to inform practice. Their involvement ensures that public health interventions are grounded in evidence and continuously improved. PHNs are catalysts for community action. They mobilize communities to take collective action in addressing health issues, fostering sense of ownership and empowerment. Through community organizing and advocacy, they help create supportive environments that promote and sustain health. A public health nurse or a community health nurse has several roles and responsibilities. As clinicians, PHNs or CHNs provide direct nursing care to individuals, families, and population groups in the community. This role involves applying the full nursing process from assessment to evaluation to deliver client centered, evidence based interventions. As nurses administer immunizations, provide maternal and child health services, manage chronic conditions, and offer counseling and education. Importantly, clinician role also extends to conducting home visits and facilitating referrals, ensuring that clients receive the full spectrum of services they need to achieve optimal health. Public health nurses serve as educators at multiple levels. They teach individuals and families about healthy behaviors, disease prevention, and self care. They also conduct group health education sessions, workshops, and community campaigns to promote public awareness on key health topics and issues. As educators, nurses use culturally appropriate methods and materials, tailoring their approach to the learning needs of their audience. Their goal is to empower people with the knowledge and skills required to take control of their own health. Advocacy is a central pillar of public health nursing. Nurses advocate for the health rights of individuals and communities, particularly those who are marginalized and underserved. They work to reduce health disparities by addressing social determinants of health and promoting equitable access to services. Advocacy may take many forms, from speaking out on behalf of clients during planning meetings, to lobbying for supportive policies, to ensuring that vulnerable populations are included in public health programs. Through advocacy, public health nurses uphold the principles of social justice and work toward a more equitable and inclusive health system. In their roles as managers, PHNs organize and oversee nursing services within their assigned health units. They develop plans, manage resources, supervise staff, and coordinate program implementation. They also serve as program managers for key health initiatives such as tuberculosis control, immunization, maternal and child health. Their leadership ensures that services are delivered efficiently, effectively, and aligned with national health goals and local community needs. Collaboration is essential to achieving population health outcomes. Public health nurses work closely with a wide range of partners, such as local government officials, health professionals, non governmental organizations, community leaders, and private sectors. They build and sustain partnerships that foster comprehensive, multi-sectoral approaches to health promotion and disease prevention. By collaborating across sectors, PHNs help ensure that community health efforts are coordinated, inclusive, and sustainable. Public health nurses are leaders in their communities. They initiate and support community driven health actions, fostering local ownership and empowerment. Through leadership in community organizing, nurses help mobilize residents around shared health priorities, building collective capacity to address health challenges. They also mentor emerging community leaders, strengthening the social fabric that support long-term health improvement. Leadership is demonstrated not only through formal roles, but also through everyday interactions that inspire trust, build confidence, and motivate actions. Finally, public health nurses embrace the role of researcher. They participate in health research such as disease surveillance, program evaluation, and operational studies. They also apply research findings to enhance their practice, ensuring that public health interventions are evidence based, and continuously refined. By engaging with research, nurses contribute to the advancement of public health knowledge and to the development of innovative solutions to community health problems. In summary, in summary, in summary, public health nurses perform multiple roles as clinicians, educators, advocates, managers, collaborators, leaders, and researchers to promote health and prevent disease across all levels of the community. Their work bridges clinical care and public health by addressing both immediate health needs and the broader social, environmental, and economic factors that influence population health. Through leadership, partnership, and community empowerment, public health nurses contribute to building healthier, more resilient, and more equitable communities, advancing the goal of health for all.